for just $85 in honor of National Heart Month. This special low price is even covered by Medicare and most private insurance plans. Connect with our office at 317-848-8048. That's 317-848-8048. Or learn more on the web at thevoiceofhealthradio.com. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Wellness Center, the most comprehensive wellness center in the Midwest. Our focus today is on ECP, putting the pulse back in your life. And Dr. Prather, does ECP help with circulation?
Yes. One of the things is, of course, we had talked about all the benefits of the heart, and there's even more things involved with that, but you have to get the blood supply to the heart. One of the things, of course, that is a huge problem is arteriosclerosis and atherosclerosis. And that's one of the big things that, procedures that are done right now, of course, people have talked about bypass surgery. You have ballooning, you have stents, and all those things are to try to keep the blood supply coming to the heart, which with our modern, lack of aerobic exercise, there is a hardening of the arteries with arteriosclerosis. There is plaque buildup with atherosclerosis. And then we have a whole problem with the blood actually getting to the heart. And the nice thing is that external counterpulsation therapy can fix that. Again, when we talked about the Maasai in Africa, they had wonderful arteries. The reason is because they had that constant aerobic exercise. And with the aerobic exercise, you can actually keep the arteries all clear. The same thing is actually true for the external counterpulsation. The external counterpulsation actually provides a ballooning in all the arteries of the body. So you're not just hitting like with a stent, you're hitting a very small area or a balloon procedure. There is actually a ballooning of all the arteries. So as you're doing the ECP, there's even more of a contraction and an expansion of the arteries. And we've had people with 90% blockage in the arteries. So there was a lady who came in. She had actually had been found to have over 90% blockage in both of her major arteries going up her neck. She went in for a surgery, and they did the surgery on the right side. And for the first procedure to clear out the arteries, and she had a stroke while she was actually having the procedure done. It had some paralysis on the right side of her face, and they rechecked it, later, and she was already starting to block up, but they hadn't even been able to do the left side. So they had heard about the external counterpulsation therapy and had wondered if that would actually be something that would be of benefit. So we got her on the external counterpulsation therapy, and after she was done, she had her arteries checked, and they were both 100% clear. There was absolutely no blockage in the arteries at all. Not only that, but then she had also had a reversal, a very dramatic reversal of the stroke, which they had told her was not going to be able to be done. So they were actually very surprised. We had a gentleman who had actually come in who had enough of heart problems that if he had actually gone through the bypass surgery, which he was slated for, to actually do that, he wouldn't survive. So they actually had him scheduled for emergency bypass. His cardiologist came by and said, no, because he already has heart disease, there's no way he would make it through. So they really didn't have any hope. We did the external counterpulsation therapy with him, and his arteries were 100, not only was his atherosclerosis and arteriosclerosis 100% corrected, but also the problems with his heart was actually reversed.
Wow, that's exciting. I remember the one gal, that had the surgery on the one side, and what she went through. There was no way she wanted to go through again
Well,
with
yeah,
the surgery.
They said she wouldn't have been able to.
Right,
They would have killed her.
What about collateral arteries?
Very, very good point. We not only does it work and clear out the arteries that we already have, but we only use about 70 to 80% of the arteries that we're actually born with.
Only 70 or 80%.
Right, and then you have what's called collateral circulation, where it's actually dormant. And unless you actually stimulate the aerobic ability of the body, those don't open up. And one of the great things about the external counterpulsation therapy is as you do that therapy, you actually open up all the collateral circulation. And the nice thing about that is even, and we always encourage people to do aerobic exercise after they do the external counterpulsation therapy to get involved in a process on that. People oftentimes don't. That was the whole reason that they got in problems in the first place. But we try to get as many as we can to do that. But no matter whether they continue their aerobic exercise program or not, the collateral circulation actually remains open.
Wow.
So that is a permanent change and a permanent opening of that collateral circulation that stays there.
So it's like new pathways that have been opened.
Absolutely.
That may never be open in your whole lifetime.
Now, if they aren't opened up, then yes, people can be. We've had people in their 80s who had never opened up their collateral circulation, and we opened it up. And if one of the things that can actually save you in a heart attack is if you have collateral circulation, then you don't have the damage to the heart. So it's a very, very helpful type of thing to occur. Because not only do you have one pathway to different areas of your body, but you also have another. So if there's a blockage in one, then you have the benefit of the other circulation coming in.
So interesting. I didn't know we had collateral arteries that weren't even...
Yeah, that's actually...
Is that throughout the body?
That is throughout the entire body. So it's very helpful to prevent strokes. It actually will help with any type of heart attack. And just the health of the entire body. But not only that, it also actually stimulates, they found that there's actually new arterial growth that actually will occur. So the hormones that actually stimulate arterial growth are stimulated, and we have found people who do continue the aerobic exercise that there's a continued improvement in their aerobic functioning. So it's an amazing type of change that not only helps the heart, but also helps out the circulation in ways that are quite remarkable.
Sounds like a lot of regeneration's going on.
A tremendous amount of regeneration.
Well, can the ECP benefit erectile dysfunction?
That is something that definitely is helped. As we open up the collateral circulation and open up the arteries, one of the main reasons that someone can have erectile dysfunction is because of a lack of blood supply. One of the ways that a man can actually measure his heart health is the angle of his erection. So the as you're
wasn't that last week's show?
Yeah. But that is actually a good measure of how old you are. And if you can actually, if you put your hand straight out, if you have excellent circulation, if you're taking your hand right out and you're looking at your hand with your middle finger pointed right on out, if it's a thumb, that's excellent circulation. As you start to decrease, then you've got the pointer finger, the middle finger, and as you go down to the little finger, then probably it's mainly because of a lack of circulation. So the angle of the erection for a man is actually a very good indicator of his circulation. And one of the things is we've had men who said, wow, I'm 75 years old and I haven't seen that since I was in my 20s.
Their wife's going, yay. Well, I mean, it makes sense.
Certainly.
It's a
circulation issue, and that's actually a very good indicator of a man's circulatory health.
We talked a little bit about the benefits of congestive heart failure already. What about the ECP? Does it help reduce reduction in blood pressure?
Yes. There are actually many different reasons for blood pressure to occur. One of them is kidney function, and we actually recommend the ECP for people who do have lowered kidney function. It is a filtration of the blood system, and if there is blockage, if there is damage to the circulatory system, you actually get a decrease in the ability of the kidney to work. And the kidney is actually one of the major reasons for hypertension. That would be a increase in the fluid in through the body in the circulatory system is one reason that can occur. And one of the things that we always tell people before they get on the ECP is go pee. Because if you don't, you're going to be asking to get up in the middle. And
right.
Even then, after people who actually have weaker kidneys will find that they will need to stop the ECP and they'll have to go pee. And the reason is all of a sudden their kidneys are working. So we actually get a reversal of kidney disease also with the ECP. It's extremely effective, just like the heart is regenerative, and the aerobic exercise from the ECP actually will reverse that. It also reverses kidney disease, so we do get changes in blood pressure. One, because of the improvement of the filtration ability of the kidney to get rid of excess fluid, but also with hypertension, there can be a cause from the heart, where the heart's trying to beat too hard. And you get the regeneration of the heart, so you don't have that. But also then the arteriosclerosis and atherosclerosis. So you don't have the pressure against the arteries. It's more elastic. And as the arteries are more elastic, you actually decrease the blood pressure. So for hypertension, it works on many different types of levels. We can see a huge change.
Okay. Well, up next, let's talk about the ECP and its benefits toward athletic performance. You can listen to the Voice of Health Radio on your smartphone or tablet computer. Just download the free TuneIn Radio app to listen to all of your favorite radio stations and radio shows. Mark the Voice of Health as one of your favorite so that you can listen to us live or to our recent episodes right on your smartphone or tablet. Connect to the TuneIn Radio app through our website on thevoiceofhealthradio.com. This is the Voice of Health with Dr. Robert Prather. You're listening to The Voice of Health with Dr. Robert Prather, where our mission is restoring hope to our patients. Our show topic this week is the ECP, putting the pulse back in your life. And Dr. Prather, we were talking about the different benefits that the ECP, towards circulation and blood pressure, erectile dysfunction. What about its benefits toward type 2 diabetes?
That is something that we have seen and that they've actually found in clinical studies, is that there's actually can be a huge change in people's ability to control their type 2 diabetes. One of the things that occurs during aerobic exercise is that there's a change in the ability in the body to actually move the glucose out of the bloodstream and into the cells for utilization. And so there's actually a balancing that occurs with aerobic exercise, and actually also occurs even stronger with the ECP. There are, as you're talking about, sugar transport, you have the insulin that actually carries the glucose to the cells. Then there's a receptor site on the cells itself, and then there's the transportation of the glucose into the cells, and then its utilization. aerobic exercise improves the body's ability for the receptors and then